All right, well, air quality remains low from the wildfires. Concerns are now also growing about the impact these fires are having on lung health. And we're also wondering about how to best protect yourself against the smoke and the particles within it.
Dr. John Granton is a staff physician at University Health Network and professor of medicine at the University Network. And he joins us live now. Dr. Granton, or John, thanks so much for being with us to talk about this. I'm sure many people watching are wondering, wow, this is going to get even worse today. What does that mean for me? Should I be wearing a mask when I go outside? Should I close my windows? What is kind of your top advice for people who do have to go outside?
Right. So it's a topical question right now. We're not used to this in Toronto, certainly in Canada. We're used to good air quality, so this is a change. We were discussing offline, you know, there are other areas of the world that this is a common day to experience, so it's something we're not accustomed to. So usually as the air quality index gets worse, the exposure to pollutants in the air increases. And it's not so much the stuff you taste, which can irritate your upper airway and make you not feel well, and some people are predisposed maybe to coughing and sneezing and what have you, compounded by the allergy season as well. But it's really those smaller particles and gases that get into the lower airway that cause the health problems. And the people at risk are older people, people with heart or lung disease, and people who have underlying medical conditions, which may be made worse by increase or difficulty breathing.
How would you actually know if that's happened to you? Is it a sudden thing that you realize you can sort of feel it in your lungs, or is this something that you go outside, you maybe exert yourself, or maybe just go for a walk, you take them in that you don't know, and then like weeks or months later, like what's the time frame?
I mean, it's a great question because there are early effects of exposure to air pollution or wildfire smoke. And then there's the long-term health effects, which lead to asthma and heart disease and other things. And we're really talking right now about the early effects. So people have likely underlying lung conditions who will start to feel short of breath. They'll start to feel tight in the chest, wheezy, like when you get an asthma attack and you feel like you have to take your inhaler. So it's really those individuals. And it's also, unfortunately, the individuals who are at risk in our society who can't escape from it. So people who are homeless and don't have access to sheltered space, can't close their windows, don't have air purifiers, which are the strongest recommendations, is just to stay indoors and avoid going outside unless you have to, avoid exercising and doing other things if the air quality index is very high.
You know, I was telling you, this is all very reminiscent of when I lived in Beijing and pollution was an everyday occurrence, and we would have these massive IQ air machines, HEPA filters that filter the air, and they're very loud. But I also have this mask with me, Dr. Granton, and it says PM 2.5. I mean, these were the particles you talked about that really get in the lower respiratory region. So when we're talking filters or masks, is this the recommendation to get the filters that protect against PM 2.5? Well,
you know, I think there's not a lot of studies looking at masks and the effects of masks on asthma and other things. But there's some engineering and technical ones, and they suggest that the filtered masks, that the N95s and the P10 masks can filter those 2.5 particles, PM 2.5. The cloth masks, scarves, other sort of things really won't do that. The trouble is they have to be a tight seal. So if you feel air coming around, that means you're inhaling those particles. So if you don't get a properly fitted mask, it's really not going to protect you. And none of that will protect you against the gases, particularly ozone, which is also at street level during wildfire smoke and also during pollution. And that's one of the ones that commonly affects people with asthma is ozone, production of ozone.
Now, we're talking right here, 299 Queen West. We're in Toronto, but it seems, you know, the further or the closer you get, I suppose, to the wildfires, how much more increased is the danger there for people watching in that part of the province or even the country versus where we are now?
It's odd because it's very geographic. So if you look at kind of a heat map of the province or different areas, it varies. So you'll get sort of winds and what have you accumulating the pollution in a certain area. So I was up in Parry Sound. It was 11 plus when I was up there. I had to come back to the city to escape the pollution, which is strange, right? So it's very localized, and it's in the air, and it comes down based on weather conditions. Not expert in that area, but there are unique effects. People are actually in the fire zone, and certainly our first providers, people who are fighting the fires, have unique risks and exposures to both their early health, burns, injuries, those sorts of things, but also long-term health exposure to that kind of dense smoke.
So I guess the main message is don't go outside necessarily for prolonged times if you have to, especially if we're reaching a 9 on that scale today.
Oh yeah, even 6 and above is
Okay.
considered moderate, and so certainly if you're 9, that's extremely high, and so people with health conditions should be avoiding that. If they can't, consider wearing a mask. For the rest of us, just try to avoid it. In the short term, it's hard to know, but you'll probably be all right. You don't need to panic and rush out and get these masks. You'll be all right.
All right.
And just use common sense.
Dr. Gretton, really appreciate your time this morning and your expertise. Thanks for joining us and sort of
Thanks
letting
for
us know
having me.
really what to deal with.
Yeah,
Thanks so much.
absolutely. Thanks
you.
so much.
Take care.
Appreciate it.